So Chika, I know you work with the community most of the time. So you are a community person dealing with vaccines. So from your experience working at the community level, what structural barriers mostly affect our healthcare access, especially to the marginalized communities?
Yes. Vaccines, primary healthcare is basically based on trust. And once we have that deficit of trust, there's a problem. Let me explain. A friend of mine decided to do insurance for 200 women who were very excited. So she said, no, I don't want you to do the government insurance. I'm going to go to Mansard. I said, no, do government. She said, no, Mansard. And she did. Mansard has a community insurance package. And then the first phase was 100 women, marginalized women. And she did that. But guess what? It was a complete failure. It was a failure because the women went to the primary healthcare center and they didn't believe it. They didn't trust the system. They felt there was something hidden somewhere. So they were afraid to go. So they will go today and then they won't go and they will go. This is not a fable. This is, I was involved. So at the end of it all, trust is the first structure. Trust. The citizens must trust the system. The citizens must trust that they will get what they want from the system. And then secondly, when they go to the primary healthcare facility, how do they feel? You have the Patient's Bill of Rights. That is a law. But when they go there, how do they feel when you go there? These are all the things, these are very, very important things that people we don't take seriously, but they are very, 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 very important. So, and after that, we talked about, we don't have patients group. Do you know that with the exit of the US aid, a lot of things started collapsing? We have a patients groups, mentor mothers when it comes to the HIV programming. But because they are no longer funded, nobody looks at them anymore. It has become like a collapsed system. So when people need to go to the primary healthcare center and they cannot get their HIV drugs, they cannot get that because at that time, everything collapsed. There was nobody to talk to. Please explain to me. If you have gone to the PHC, you cannot get your drugs, everything is on collapse. What do you think will happen to them? Then they face traditional doctors. They face other alternatives and set us back another 10, 15 years. To now put the icing on the cake, we have cases where you even have, they're on strike. Some PHCs are on strike in the FCT. So what does that mean? Can you imagine being on strike? How can PHC be on strike? I mean, how? So what it means that everything we have done, creating demand generation, talking about to make sure that the health systems are strengthened, using PPP, using CSOs, everybody, CSP, using adopt a PHC, everything. Then the person goes to the primary healthcare center and silence. What will they do? They go back to all the traditional things that may not work. And then by the time everything comes together, because this one sits directly at the table of the local government chairman, the local government, because those are the ones that pay because of minimum wage and all the challenges of minimum wage. So what do you want them to do? These things are real things that happen at the community level. And before I go further, I just wanted to say that even in this, our beautiful conference, they talked about PPP, they talked about government, but unfortunately, they forgot to mention CSOs. But I'm here as a CSO rep to remind everybody, hands must be on deck if we want universal health coverage. Please, Dr. Njide and your team, please, I'm begging you, when you have the next conference, please mention CSOs. We have something to bring to the table. Now, and if you want everybody to make it work, you have to add our voice. We have something to bring to the table.
I see a lot of activities, of CSOs, NGOs concentrated in urban areas. I don't know if you've noticed some things like that. Okay? But how can we ensure that universal health coverage benefits the underserved communities rather than being urban center focused.
Okay.
I mean, there are, I take some examples like we have some communities in Delta State, for instance, that you do 2 hours on the boat to get to. We don't see CSO activities in those places. But you may educate me better.
Okay.
Thank you.
Thank you very much. I beg to differ. CSOs, CBOs, FBOs are everywhere. They are everywhere. So you cannot say that CSOs are not in the... You just want me to talk. Anyway, the marginalized, to start with, what they have is immunization. Because first and foremost, they are already poor. They can barely feed. So what they have that government gives them for free is immunization. That gives to their children for free is immunization. The National Health Act and the Vulnerable Group Fund by Senator Oloriegbe, it speaks to that directly. So, and then the Basic Healthcare Provision Fund, the government has a catalytic fund from the Basic Healthcare Provision Fund that caters to revitalizing about 7,000 primary healthcare centers, and now they want to revitalize it up to 17,000. But guess what? 17,000 primary healthcare center is a far cry. So it is very important that all hands are on deck. So, and then I want you to just state the fact that this is where PPP comes in. It's a catalytic fund, means that government is in charge, is talking, and then other people join. And then the primary healthcare centers or primary healthcare as we see it needs funds. Let me speak like a worry girl that I am. Now money I make I on float. You know? So at the end of it, the government is on the driver's seat. We have to fund PHC. The poor need it. And the funds have to come out. The government has to be at the driver's seat to do that. And then the PPP, please support us. CSOs are also going to be there. Right now, as we speak, I don't like saying the immunization funds have not been released for 2024. As we speak, let me give an example of vaccines. If there's a shortage of vaccine, who are those that will suffer? The poor and the marginalized and the vulnerable. So my appeal is that the vaccine funds should be put somewhere. We shouldn't play with it. It should be a predictable fund, maybe like first line charge, whatever it is. Put it somewhere to make sure that at any point in time, the first one is have money to buy them, because that is one of the indicators of primary health care. But after that, when I talk about demand generation, where all of us together will start to create demand, continuous education. And then there's a program which we have. I like to speak with examples called Adopt a PHC. And there are big people that are talking about Adopt a PHC. What we're talking about is we want the people in the community to adopt a PHC. So let me give you an example. There's this Umuadas in the one community in Imo State, where they got a grant from one of organization, 15,000 naira. They got a grant. And they decided to use 500 naira out of that grant to support their PHC. They bought a weighing scale and a BP machine. Immediately, they become accountable. Every week, you see them going there to go and monitor their scale to make sure that the scale is being used. So that is what we're talking about. We want all of us here adopt a PHC near you. Adopt and start to ask questions so that the poor and the vulnerable will be catered to. That is where, so creating demand, sensitization, awareness, don't give up. Let all hands be on deck. PPP, please help us. CSOs, we are there. And then the citizens, it's about them, nothing for them without them. Bring them on the table. Let everybody, by the time all of us become passionate about our PHCs, we are all asking questions, doing what we need to do. You will be surprised what will happen. So my own here is hands on deck. That is it. PPP, CSOs, FBOs, and their role to play. So we don't intend to do government work. So usually the states are usually involved, or local government. So we develop together with the government an implementation framework where we know exactly what the government is supposed to do and what is left. So that was that this is what the government can. Organization, a restaurant owner, Bioback. If you're in Abuja, you would know her. Bioback decided, oh, you know what? I don't want to adopt a PHC that's already being funded by Basic Healthcare Provision Fund. I want to adopt a PHC that is not funded by Basic Healthcare Provision Fund. And these are the things that are left. So what did she do? What was left was to fence the place because thieves were attacking and people were not coming for immunization, were not coming for ANC, they were not coming for those things. So she spent like 3 years or managed to fence the whole PHC. Not only that, she repaired the toilets as well. Of course, in collaboration with the government, she repaired the toilets. You know that just these two things that she did, ANC services improved from 50 to 150. Do you know what it means? It means the lives of over 150 women every week are saved. When we went there, I saw the in charge. Do you know what it means to work in a PHC and love your job? Many of these people love their jobs, the health workers. But the system, the whole environment is not conducive for them. They had a big toilet. By the time Bioback renovated 9 of the toilets, I went there and I saw a happy environment.
Thank you.
I saw a happy environment where the in charge told me, Chika, see my key. I even have 1 toilet to myself. If people that were coming for ANC were happy. So this is what we're talking about. It's not only about going. How do you make them feel such that they continually visit the primary healthcare centers when it is necessary?
Thank you. I mean, I like this. We can go on and on this subject, but again, we're talking about, so we can attain universal health coverage. So people from old boys associations here, people you come from communities, your old boys association can decide to renovate a PHC, re-equip a PHC, and make it functional.
Yes.
And you would have done, something noble for that community. Thank you. Thank you.
Communicate with the government so that you don't do government work.
Yes, of course. You talk to the people at the local